Good day, everyone. I'm Dr. Bevin. I head the emergency department at Sakra World Hospital. See, first is one thing is I talked about triage and I said how we assign priorities, and based on those priorities which are assigned, we will adequately adjust the treatment response and all these things to that particular patient. But in certain situations, like when there is overcrowding, when there is, I would say those are the things that add pressure on the physician, wherein you have to manage differently. So that time it comes to the point wherein sometimes you might need to call in additional help and delegate. So that time it does work like, how we work in a disaster sort of a situation, we will work. Now there is another type of a high pressure situation which might face. Like let us say that particular situation comes, let us say there's a significant amount of media presence, it is from police point of view, it is an important case, there has been somebody important involved in that particular situation. Let us say some crime has taken place or some violence has taken place in that. So those are also high pressure situations wherein different people will have to get involved. Agencies from the hospital. See, as a head, I'll have that role to make sure that I supervise that particular situation. There may be our public relations team which might get into the pictures, or in the statements are properly done. And there might be another thing wherein you might have additional help coming in, like for example, senior management within the hospital, etc. We will make sure that we talk and this and that before we get certain things across. Sometimes there is a matter of confidentiality also in such situations. So that is another different kind of a pressure. But in general, I would say that the biggest pressure that we feel is like the situation wherein we don't have enough people and there is a lot of burden in the coming to the department. So that is where the pressure is. For that is something that we are dealing with. We are trained to deal with that higher pressure situation wherein a larger number of patients are coming or a sicker patient is coming. That is also pressure. I'm not saying no. When the patient is sick, let us say that it is a dying patient has come to you, then there is a different kind of a pressure of performance in that particular scenario. And there may be a pressure to do certain activities before that time is lost. So every kind of a pressure, there is training. So we have to incorporate that into training, and we have to incorporate that into our planning and into a contingency plan, so that that pressure is not going to affect the care of the patient.